Awake hysteroscopy. Is it the right choice for me? To help inform your choice, this film was made with women who've had an awake hysteroscopy. There are different ways of doing the procedure. Best practice is the no-touch technique shown here. If your doctor or nurse doesn't use this technique, you have the right to ask to see someone who does. Sometimes another procedure might also be necessary. Discuss all options with a doctor or nurse before you agree to go ahead. For more information, read the Outpatient Hysteroscopy leaflet from the Royal College of Gynecologists.
I'm somebody that likes to know what's going to happen, just so that I know what to expect.
Yeah, I do like to know what's happening. Partly because I like to be able to tell other people about it afterwards if anybody asks me.
I'm a gynecologist, and awake hysteroscopy is really close to my heart. I've been doing that for many years.
I'm a gynecologist, and my passion is to empower women to make choices which are best for them.
I was having occasional bleeds when you're not supposed to, breakthrough bleeding.
I had to have a hysteroscopy because I had some unexplained bleeding. I received a letter that explained what would happen, and it included a really detailed leaflet.
Outpatient hysteroscopy involves examination of the inside of your uterus or womb with a thin telescope. The actual procedure usually takes up to 10 to 15 minutes.
On the day, I recommend to take a painkiller about an hour before your appointment, and that could involve taking paracetamol or ibuprofen. The other thing that might be useful is bringing some music on your mobile phone so you could listen to that whilst you're waiting and during the procedure.
I think I actually took the morning off work. Had a nice bath and everything, and just made sure I felt relaxed. I'd made sure that I was prepared. I read my leaflet again in the morning. I made sure I'd taken some painkillers. So when I arrived at the department, they had a consultation with me to make sure that I understood what was going to happen.
Before we start our procedure, I draw a diagram for you to explain exactly what's going to happen and really emphasize that at any point you can stop and you have a voice, and it's a two-way dialogue, and you can tell me that you prefer to take a big breath or think, or we can even stop the whole procedure.
It was explained to me that I could stop, and that's something you would be able to do. And you would just have to put your hand up and say, stop. I went off and got changed into the lovely hospital gown like you do, with the lovely little blue slippers on.
I saw all the equipment on, but as what I expected. It's sort of like a doctor's surgery. You're somewhere for you to lie or sit. You were sort of perched on the edge with your legs over, I seem to recall.
In the room, you'd find at least 2 to 3 people. One person is usually responsible for the technical side of things. Then you have the person carrying out the hysteroscopy, and then one person who's really just there to support you, and that could be holding your hand or talking to you during the procedure. Don't forget to breathe. Try and relax, because if you are relaxed, the pain experience is much less.
I really focused on making eye contact with the people that were talking to me and smiling and breathing.
Once you've made yourself comfortable on the bed, the healthcare professional will be confirming with you that you're ready to go ahead, and then some water is put inside the vagina to relax the tissues and act as a kind of painkiller. So the telescope will then travel right up to the level of the cervix.
It may feel a little bit tense, it may feel a little bit crampy, because it's a very narrow area. It's a neck of the womb. And once the telescope is inside the uterus, we just examine the cavity, the lining, to make sure it's looking normal, or if there's any areas that we're worried about.
Oftentimes the only thing that is needed is a photo, and then the telescope is taken out again. And the whole procedure lasts about 3-4 minutes.
In some cases, we do need to take a sample of the lining. or take a biopsy, or remove a little skin tag called polyp, or sometimes there are small fibroids that need to be removed. This could be another part of the procedure which could be painful, and usually the pain is like a period pain.
And they gave me the option at that stage of, are you happy to continue with that? And I felt very much I was managing okay, and it would be a good idea just to get it done. Then there was a period of time when they were taking the biopsy where it was a bit more uncomfortable still. I would say that lasted maybe for a couple of minutes, but then afterwards I felt a little bit uncomfortable and achy.
At home, you might expect a little bit of bleeding, which should be usually lighter than a period, and there might be pain, and home remedies to look for include a hot water bottle or more painkillers. Most people tolerate the procedure really well, but there are some people who find this procedure very difficult, and that might be due to severe pain. It is not easy to always predict which people that might be.
Feeling pain and the degree of pain is variable. It's variable between women, but it also the same woman can feel differently on different days. If every intimate examination in the past was quite traumatic for you, if you've had several smears where you felt lingering pain for days, if you really can't face being examined awake, these are all important things to speak to your doctor, because there are alternatives.
In some cases, it might be better to have a general anesthetic on another day. In some units, there is a larger option of pain relief available, and that might involve gas and air or using a technique called conscious sedation.
I actually had concerns about the intervention that would be needed in a general anaesthetic, my recovery time, the fact that maybe I would need to take more time off work. And actually I felt that if I could manage the procedure and the discomfort, that would long-term be better for me and safer for me.
Any surgical procedure has risks and benefits, and these vary from person to person. Further information can be found in this leaflet published by the Royal College. I would also encourage everyone to come up with all your questions before the procedure and discuss everything you want to know with your clinician, because that puts you in a much better position.
I think it's important that we are, as women, able to feel in control of not just the information but the procedure itself. I think that if you are able to feel in control, you probably feel better. I certainly did. You feel better through the whole process.